How long do HPV test results typically take? Have you ever wondered how long it takes to get results from an HPV test? The answer is quite important for many people, especially those undergoing cervical cancer screening. Generally, HPV test results take about a few days to up to 2 weeks to be processed and returned by the laboratory. However, the exact timing can vary based on several factors. First, the type of healthcare facility where the test is done can influence how quickly results are available. Some clinics may have faster turnaround times than others. Additionally, the specific type of HPV test used can affect the processing time. For example, if the HPV test is done alongside a pap smear, which is common practice, it may take longer than if it were done on its own. Once a sample is collected during a pelvic exam, it is sent to a laboratory. There, specialized tests are performed to detect the presence of high-risk HPV types that are associated with cervical and other reproductive cancers. This molecular testing typically requires more time than simpler tests. Timely results are crucial for follow-up care. If the HPV test comes back positive, healthcare providers may recommend further evaluation, such as repeat testing or a procedure called colposcopy. This helps monitor or detect any precancerous changes early. On the other hand, if the test is negative, it usually supports longer intervals between screenings, which helps reduce unnecessary medical interventions. In summary, the typical turnaround time for HPV test results is between 3 days to 2 weeks. Factors that can influence this timing include the type of test, the capacity of the laboratory, and the healthcare setting where the test is performed. Understanding these timelines can help patients manage their health better. If you have questions about your specific situation or test results, it's always best to consult with your healthcare provider for personalized advice. Prompt communication of results is essential for ensuring early detection and management of HPV-related reproductive health issues.